Hi, and welcome to the next edition of the Academy by Acclivity Health Solutions. I'm Jeremy Powell, the CEO and one of our founders here. And today we're going to jump into getting early wins. As I can imagine, everyone who attempts to sort of step into this journey around alternative payment models worry about the length of time that it takes to sort of get traction. They may worry about losing some fee-for-service revenue. They may worry about what it means to staff or the potential future income they should and could create under these models. And so there's a lot to think about here when it comes to early wins. Because everyone is different, I often try to put things into sort of a more general bucket and help us think through, what do you likely need to sort of start with? And if you start with where you are, and then start with why you'd want to do this immediately after that question. So where you are is in an increasingly complex environment. The landscape around healthcare, if you just follow what the market has done, through the first huge pandemic the size of COVID in 100 years, what all that did to us relative to the mass exodus of clinical staff and resources sort of leaving en masse. All of the inherent biases that we have related to value-based care. I can remember not too long ago, the Affordable Care Act was brought to law, and there was, rhetoric around death panels and rationing of care. Those things are not the kind of concepts we hear thrown around, today, but there still are lots of misunderstandings and misconceptions around what it means to be in a risk stratified pool, what it means to be, chasing reimbursement based upon the types of care you deliver. There's always the decision making you have to make around, is this the right time for you to jump into this pool? If you're conscious about bottom line and higher performing financially, there's this investment period of about 18 months in most models before you make your incremental first dollar. And then the last thing I want to spend the most time on in this tile in the bottom right, which is how do you purposely ensure that you're working both types of payments, both fee-for-service and alternative payments in the same period? And often in this window where we're still getting carrots and there's the eventual sticks that come after this, the fact that there are lots of carrots on both sides of the equation. You can make fee-for-service dollars in annual wellness visits. You can make fee-for-service dollars in transitional care management visits. You can make fee-for-service dollars in chronic care management visits. You can make fee-for-service dollars in remote patient monitoring services. So you can make those particular investments and get some of those dollars recouped immediately in fee-for-service world, while you also see their future come established with value-based care contracting components. And we would say, focus on those things that pay twice. Have the opportunity to get your dollar now and later, and be very focused purposely on ensuring that you have that sort of inside your intrinsic model of care, inside how you think about what contracts to get into, inside of how you manage these complexities related to, the models themselves, the resources that you're going to, sort of have to retool for this kind of approach. And obviously there's a lot to talk about in each of these tiles, but, really what we think about is how do we meet you today where you are? And then why is this time the right time to make this decision? Some of the things that jump, right off the page would be, there are carrots today that in the eventual future will be taken away, and only taxes or burdens be applied as sticks in the future. So be mindful that in this window where you can get perks, those are usually easier paths to success than where you're only forced kind of at gunpoint to sort of change your model of care or retire and get out of the field otherwise. Like, those really are the sort of pointy ends of this that come later. But if you've watched Medicare and how they've talked about who all is going to be managed under fee-for-service, again, we've just stepped into 2024. And you can imagine if you only have 6 years and now burning less than 6 years before Medicare expects to have everyone under alternative payments, now is the time to use these carrots to your advantage. Looking forward to chatting with you more as we go through future Academy content. If you have suggestions, or if you want us to invite you to actually speak amongst us in a panel or join us for our podcast, send your name and information to info@acclivityhealth.com. See you soon.